My name is Amanda Cole-Branson. I'm going to be doing your physical assessment today.
Great.
I'm going to wash my hands. Okay, so I'm noting that my patient is well appearing. She's put together and well nourished. How are you feeling today?
Good. Yeah.
All right. So she's feeling well. Do you know what month it is?
Like, do I? It's February.
Great. And do you know who our president is?
Biden.
Wonderful. Okay. And what state are we in right now?
Right now?
Mm-hmm.
Florida.
Great, Florida, because we're visiting. Okay, so the patient is alert oriented. I'm going to tilt this up a little bit. Her skin color is appropriate for her ethnicity. I'm just going to look at your skin. Yep. Okay. Nice. I'm going to assess her scalp. Palpating. I feel no lumps, no nodules. Her hair seems healthy. Even hair distribution. Okay, I'm looking at her face. It appears symmetrical. Her eyebrows, her eyes. Okay, her ears. Can you raise your eyebrows for me? Good. They're equal. Can you frown? Yeah. Okay. I'm assessing cranial nerve 5 and 7. Can you smile with your teeth? Big smile. Great. Can you stick out your tongue? All the way. Nice. Okay, midline. And I'm gonna touch your face. Is that okay?
Mm-hmm.
Okay, so we're just gonna have you open your eyes and I'm going to, okay. Great. Okay. And can you close your eyes for a moment? Okay. Can you feel me here?
Mm-hmm.
And can you feel me here?
Mm-hmm. Yes.
Okay, and here?
Yes.
Okay, that's cranial nerve 5 sensation. Can you clench your teeth? Good. Okay, unclench. Great. Okay, that's the mastoid bone. And then I'm going to palpate your temporal muscles. Okay, clench again. Okay, great. Perfect. Thank you. Okay. So now we're going to move on to our eyes. I'm going to do the visual test. So we're going to have you do the Snellen chart to do the central vision. So as if I was 20 feet away, which I can't in the small space that we're in. But I'm going to have you cover one eye.
Mm-hmm.
And I'm going to have you read the smallest line here. Can you read this?
LTFPH.
Great. Okay. And then, yep, the other eye.
LTFPH.
Okay, perfect. So if I had 20 feet, I would say she had 20/20 vision. We do not have 20 feet, unfortunately. So I'm also going to do peripheral eye assessment. So I'm going to have you cover one eye and you're going to tell me how many fingers. Okay, hold on. Okay. So look at my eyes.
Mm-hmm.
Have your eye covered,
Mm-hmm.
and then you tell me how many fingers I have.
2.
Okay.
3.
Okay.
4.
Okay.
2. 3.
Very good. Okay, can you switch to the other eye?
Uh-huh.
Okay, and again.
2. 2. 3. 4. 3.
Ooh.
2.
Okay, good. All right. Now we're going to look for the corneal light reflex. So hold on one second. Let me get my pen light out. Just going to dim the lights in here. Okay. So 2 feet shining. Okay, so I'm going to just look at the pen light. Good. I can see the reflection in her pupils. Okay. Great. Okay. No, it's still going. It just keeps timing out. And then I'm going to do, I'm going to assess your cranial nerves 3, 4, and 6. We're going to just follow the pen light without moving your head, okay?
Mm-hmm. Mm-hmm.
Very good. Okay, perfect. Okay, so if you can just follow the pen light again. Sorry, it's bright.
I don't think I have to. Oh, okay.
Good. Okay. Perfect. The pupils are equal, reactive. They are, well, let's check accommodation. Can you keep your eyesight on the pen?
Mm-hmm.
Very good. Okay, perfect, perfect. Okay, so I would make sure I wash my hands. Let me turn the light back on, well, for a second. I'm just gonna assess your eyes. Gonna lift your lids up. The conjunctiva looks healthy. So does the lacrimal duct. Okay, perfect. Very good. All right, and now actually I need to get my ophthalmoscope. Red reflex, the optimal disc, and the retinal background. Okay. Yeah, I see the red reflex. And the optimal disc. Okay, all right. Okay, I'm going to come in for this one. I'm going to touch your eye. Do you see the red reflex? Good, and there's the optical disc. Great. Okay. Perfect. Let me just get this tool ready while we're looking and turn back to the light. Okay. So I'm going to be looking at her ears, making sure they are symmetrical. Good. They look good. Okay. I'm going to be pulling up on the pinna. I'll be looking in there in a moment for the optoscope. So I'm going to be assessing her ears. I'm going to be looking for the temporal membrane. So I'm going to lift up on the pinna. Okay. I see the temporal membrane. There is cerumen, and it's gray, pearly. Okay, come in on this one. Okay, and this one, oh, there it is, gray and pearly as well, with a fair amount of earwax, which I would then clean for my patient, but I'm not going to right now. Okay, perfect. So I would do the whisper test first. So if you can occlude this ear for me, and I'm going to say
99.
Great. Okay, can you occlude this one?
Apple.
Perfect. Okay, so she heard both of my words correctly. If she didn't, I would move to the other test, but I will move to the other test either way right now. So I'm going to do the Weber first, which is looking for adequacy of bone conduction. So basically, you're just going to let me know if you hear it in both ears or if one is louder than the other. Okay, hold on one second.
Both.
Okay, good. Okay, then I'm going to be doing the Rhine, and the Rhine is for adequacy of the air conduction. So I just want you to let me know if you hear it best when I put it on your bone or in front. Okay.
It's louder on the side of my ear.
Up front?
Yeah, like how it is now.
Very good. Okay, I'm going to do this ear as well. Sorry if I'm occluding the video. Okay, can you hear?
Yeah.
And then I'm going to go in front.
It's louder.
Very good. Where is it louder?
The air conduction is louder.
Very good. All right, thank you. You very smart patient, you. Then I'm going to get my tool ready again because it kind of came off. No big deal. I'm looking at the nose. The nose looks good. It's symmetrical. I'm going to actually palpate the bridge first. So I'm going to palpate the bridge of her nose. And then I'm going to palpate the frontal sinuses. Okay. And I'm going to palpate the maxillary sinuses. Good. Do you have any pain when I'm doing that?
No.
Great. Okay. Otherwise, I would be worried about maybe a sinus infection or buildup there. No, so no tenderness. Now I'm going to look at the sinus cavity. Look at the turbites and the patency in the nasal septum. I'm just going to place my hand on your nose. Sorry. Oh yeah, looking good. Yep, okay. Now I'm going to go to the other nair. Very good. Okie doke. Nice. Okay. Ooh, close your eyes. Do you smell anything?
Yeah.
Okay, great. So her sense of cranial nerve 1 is intact. Then we're going to move on to the throat. Her throat appears symmetrical. Can you breathe on me? There's no obvious odor.
Like what?
I'm going to assess the inside of her mouth for the buccal mucosa and look at her gums and her teeth and her tongue. Very good. Okay, I'm just looking. I see the buccal mucosa. Her gum health looks good. I see no redness, no swelling. I'm going to just touch your bottom. Very nice. Looking at the gums. Can you stick your tongue out and say, ah? Great. Her uvula is midline. Very nice. Okay. Oh, I'm sorry. Can you move your tongue up, down, to the side, to the other side? Wonderful. Okay. And then I don't have anything to assess for taste right now.
My taste is fine.
But her taste is fine. So we're going to move forward with that. And gag reflex.
It's intact.
I have nothing to test that with either, so that's that. Then we're going to palpate her lymph nodes. None of them are palpable at this time. Wonderful. Okay. Good. Now I'm going to check the carotid pulse. Good. Intact. Good. Intact. Okay. Her trachea is midline. I'm going to assess her thyroid. Thank you for swallowing. Perfect. Okay. And now I'm going to grab my stethoscope and auscultate the carotid arteries for any bruits. No? No? Great. Okay. Moving on to the lungs. So I'm going to, let me just make sure this is still recording. Good. I'm going to come around. Oof, I gotta hurry it up. So can you take a deep breath for me? I'm checking for thoracic expansion. Very good. It feels good. Now I'm going to have you say 99 a few times. I'm checking for tactile fremitus.
99.
Good.
99.
Good.
99.
Good.
99.
Let's maybe have you turn actually so that the camera can see us doing all of this. Just like that. Thank you. Okay, so I did 99, 99, 99, 99, 99. Okay, now I'm going to percuss. I would percuss like this. The same method I would auscultate. Okay. Ooh, can we pause this video? I need a pen so I can do. Oh, I do have a pen. I don't know where the marker is or the measuring tape. Okay, she's gonna look for it as I get ready to do the diaphragmatic exertion. So I'm going to have you take a deep. Okay. Take a deep breath and exhale and hold. Hold that, okay? Okay, very good. All right, this pen isn't working, but it's by this freckle. And then I'm going to have you do a deep breath and hold it when you take that deep breath, okay? Good. actually, and here is the, so here to the freckle. So I would then measure, and I would make sure it was less than 5 centimeters, which it is about 2 centimeters. So that is intact. Then we would go to the front of the chest. And I would make sure to look at how she's breathing. I would check her respiratory rate and the pattern. I would palpate her lungs, check for thoracic expansion here. Very good. Great. Okay. I did not auscultate your back, but I would auscultate here. Good. Here. Good. I would say take a deep breath. And I would go down the back just like I did the percussion and the palpation. Okay. And then the heart. Okay. So I would auscultate the different areas of the heart. So I would go down to the right side of the sternal border, looking for the second intercostal space, which is here. And this is the aortic valve area. Very good. S1 and S2. And I would go down second intercostal space to the left sternal border for the pulmonic valve. Yeah, okay. And then I would do the third intercostal space at the medial left stand at the border. So I would go down one more, and that's Erb's point. Yeah. And then the fourth intercostal space for the tricuspid valve. Good. And then I would do the fifth intercostal space in clavicular line, so down here for the mitral valve area. Very good. Okay, and now we're going to try to do the everything is normal. S1 and S2 are noted. No murmurs or bruits or rubs. Now I would assess for jugular vein distension. So I would have them lay supine. Oh, sorry. It's okay. Okay, so we would have her go up at a 45-degree angle. Please look that way. Just kidding. Got to move you a little bit. Yeah. Okay, so I'm going to look for this. All right. And I would measure the angle of Louis and the jugular pulsation, add 5 centimeters. So that would then be 7. Okay, you can come back up. Now I'm going to, oh, actually, you can lay down. I'm sorry, lay down. And I'm going to assess the aortic. So, thank you. Between the xiphoid and the umbilicus. All right. Good, I'm auscultating there. If you can bend your knees, I would be palpating like this. Good. And then the renal artery. Good, you can put your legs down. Thank you. Iliac would be right here. And then the femoral would be here. Good. And the femoral would be here as well. Great. Okay, so they are all intact, no bruise, no thrills. And then I would inspect and palpate all of my extremities, including my pulses. So I would do the radial, ulnar. I'm good, I'm good. Brachial, let me just make sure you're in the screen. Brachial. Good. Popliteal. Dorsalis pedis. You can't see the foot, but it's here and here. Great. Okay, and the pulse on each limb is about 2+. There's no edema in any limb. And let me just check the cap refill last. Good. It is less than 3 seconds. Skin turgor is good. Great. Okay. Thank you. You were perfect. All right. Thanks.